justice, in the courts, in public policy, and in our society, working across the issues that are central to the lives of women and girls, especially those who face multiple forms of discrimination, including women of color, LGBTQ people, and low-income women and families. And I'm somebody that you can reach out to get connected to support on a whole host of issues in the States, from workplace issues to tax credits to healthcare to education and childcare. And you can also turn to our newly updated state playbook for gender justice that gives a roadmap for working on many different issues that you care about and some initial tools. The roadmap, the playbook, includes 5 cross-cutting policy agendas that are listed here, as well as policy briefs that lay out the elements of a specific policy issue and talking points and data to help advance that issue as well. And also some links to further law center and partner resources to better understand that issue. And the playbook includes, the update this year includes a COVID-19 recovery agenda that lifts up some of the issues from healthcare to childcare that are really crucial for a recovery that truly works for all of us. But frankly, all of the gender justice policies in the playbook are really crucial to rebuilding from the COVID crisis, because women, especially Black and Brown women, are bearing the brunt of this pandemic and economic crisis. Women, especially women of color, are predominate on the front lines in frontline jobs where they continue to be undervalued, even as the rest of the country is depending on them, on their work as never before. And women are taking on the lion's share of unpaid caregiving. And women are also being hit the hardest with job loss. As of December, our research team crunched the numbers and found that nearly 2.1 million women had left the labor force since the pandemic had started, including more than 1.1 million Black women and Latinas. And in fact, all of the jobs lost in December were women's jobs. That's a really striking number. So with this webinar, we're going to lift up today how centering gender justice in our COVID response is essential to recovery, and what policies concretely we must work on, and what strategies we can use to advance these policies, given the many constraints of this moment, including fiscal constraints. And I just want to name that today's webinar and the playbook do not cover all of the gender and racial justice issues that are so crucial to this moment. We focus on some of the state policies the Law Center works specifically on and can provide support on, but we hope attendees will drop into the Q&A box other important gender justice policies you're working on in this moment, or strategies you're using to gain support for those. And we'll try to save time at the end to lift those up. So we're gonna hear first from my colleague, Kyra Miller, and our state partner, Samir Tanna from Illinois Action for Children about childcare policies and COVID. Then we'll hear from my colleague, Sabrina Bernadel, about education equity and safety issues. And then from Cassandra Welchland with the Mississippi Black Women's Roundtable, and myself about workplace rights. And my colleague, Mara Gandal-Powers, will share about how we can and need to advance healthcare, including reproductive healthcare policies that are so important right now. And we'll round it all out with John Whiten from the Center for Budget and Policy Priorities on messaging tools and strategies for pushing back on austerity and economy narratives that are really being used right now to stop a lot of these gender justice policies. With that, I'm going to turn it to Kyra.
Hi, thanks, Andrea. So I'm just going to talk a little bit about the childcare workforce and what's happening right now with COVID. And as we know, the childcare workforce, many of whom are women and women of color, are the backbone of our economy, which has been highlighted by the pandemic. And the pandemic has also underscored and exacerbated the many challenges that the childcare sector has faced for decades. Working families across the country find it extremely difficult to manage the high cost of childcare, and the pandemic has done nothing to help that. Women, especially women who are typically paid 82 cents for every dollar paid to their male counterparts, are having an extremely difficult time. And during the pandemic, there's been a decrease in childcare subsidies, and more women have been forced to leave the workforce to care for their children. Additionally, childcare workers across the country whose wages are typically less than $12 an hour have lost jobs due to childcare closures because they're unable to stay open with the increasing cost of childcare and all of the additional cleaning and health supplies that are required due to the pandemic. Families, childcare workers, and providers need stability through policies that contribute to affordable, high-quality childcare, and this cannot be done unless there's a significant increase in funding. States such as Illinois are making some progress and pushing for increased funding and addressing the immediate and long-term needs of the childcare workforce and the families it serves. However, for a full and equitable recovery from this crisis and to strengthen our economy, we need to support structural reforms and invest in childcare at the state and federal levels. So now I'll turn it over to Samir.
All right. Hello, everyone. Samir Tanna with Illinois Action for Children. I want to highlight a couple things in Illinois. First off, we have lost 26% of families in childcare since February. 93% of those families are in our childcare system are headed by women. So you can see how this disproportionately affects them. And also well over 90% of the early childhood workforce is also women, especially women of color, as mentioned in the report. So, this pandemic is hitting women, especially women of color, much harder than men, and they're feeling the brunt of it. I did want to mention some of the challenges we have in childcare. We obviously, just like every other state, is having a loss in state revenue. We have a $4 billion budget deficit. If you count, our early childhood program is one of our biggest human service programs. We need to make sure we have to figure out how to preserve those dollars. Our state legislature is not meeting regularly, which does make it hard to make some changes in early childhood funding. So we're really trying to focus on changing policy rather than changing law. Additionally, we have a lot of uncertainty of additional funding. So I think one of the things that we want to do is take the money that we have and spend it. But if we don't know if we're getting more money, how quickly do you determine how to spend those dollars? So we do have a few strategies that we focused on to alleviate some of these challenges. The first one is including parents and providers into parent voice into the mix, right? We're surveying parents, us at Illinois Action for Children plus the state. We're surveying providers. We're talking to them constantly. We're trying to figure out how to best serve them. We are including providers in every formal letter and request we're sending. We're not just saying the advocates would like to reduce copays. We're saying Illinois Action for Children plus a list of a couple hundred providers are also asking to lower copays for families. We're also using social media. I think one thing we see a lot on social media is that we're always negative. We're saying, oh, we need this, we need that. We're not getting this, we're not getting that. I think using social media, we found a lot of positivity in asking and thanking our administration in Illinois to thanking them for the things they have done, like lowering copays, paying for enrollment instead of attendance, and that has actually helped us. We're seeing that we're getting some of these policies re-upped with the new money that we've received. Additionally, I think what we've done is focus on making policies the current policies more family friendly. So not really reinventing the wheel. We've expanded our family friend and neighbor provider capacity. Instead of serving 3 children during the pandemic, during the beginnings of the pandemic, they were able to serve 6 families. We didn't have 6 children. We didn't have to go to the legislature to make that happen. We could do that in policy. Again, I mentioned the reduced copays. Right now, we're at $1.25 for all families. This helps providers keep their enrollment up, but also helps families who may be in and out of care because of their own exposure to COVID or an exposure at their program to COVID, that they don't have to pay twice for care. They only have to pay $1.25 because of the way our system's set up. We can't get it down to zero. But they'll only have to pay $1.25. So if their program is closed and they have to make other arrangements, they haven't spent maybe up to $200 or $300 on a copay and not getting care. And it's also a de facto rate increase for providers. They don't have to chase families around who can't afford to pay the copay. They're actually going to get it through the state subsidy. And then lastly, our last strategy was trying to use funds meaningfully and quickly. Illinois used coronavirus relief funds, not childcare funds, over the summer and fall to pay providers, pay our 5,000 licensed providers about $290 million from July through December, just to cover additional expenses of providing care during this time. The need for additional PPE, the need for additional cleaning, the fact that we had stable classrooms so that providers couldn't combine classrooms at the end of the day, meaning you had to pay staff to be there for longer. I really think that these were some really good strategies that we use, and I think are replicable in other states. And I'd be happy to talk to others about that going forward. So thank you.
Thank you so much, Samir and Kyra. If folks have questions, feel free to drop them in the Q&A box, and we'll make sure to get to them at the end. But with that, I'm going to turn it over to my colleague, Sabrina.
Thanks, Andrea. Hi, everyone. I'm Sabrina Bernadel. I am an Equal Justice Works Fellow working on the Education and Workplace Justice team at the National Women's Law Center. And today I'll be talking to you more about COVID-19 and education, and specifically our strategy on counseling, not criminalization. For some context, criminalization of students has been an ongoing educational crisis, especially for students of color, that the pandemic has only exacerbated. Before the pandemic, data has showed that Black girls were 5 times more likely to be suspended and 4 times more likely to be arrested at school. But these aren't just, isolated incidents, but rather a chronic and natural outcome of placing law enforcement in schools and treating students like criminals. And that includes surveillance technology and other security measures like metal detectors in schools. And it's also a result of adultification bias, which means when adults perceive Black girls as less innocent or less in need of help than their white counterparts. And that just kind of raises the stakes when those adults are police officers enforcing school discipline. Now, I'm going to take a minute, not too long, but I want to see, I want to gauge when you in the audience think that some of these events have happened. So if you could just drop your guesses of the year in the chat, let me know. I'll read some of them out, but I won't spend too long on it. I'll probably just announce the answers pretty immediately. But one example, a Black girl arrested for taking too much milk in the cafeteria and being disruptive at age 11. Any guesses as to what year that happened in? We have 2019, 2020, a bunch of 2020s, some 2019s. Correct, 2019, October 2019 is when that happened. A Black girl arrested for throwing a tantrum at age 6. Any guesses? 2019, 2020, we have a 2018, a 2016, everyone's pretty close. Yeah, there were 2 similar events kind of like this, but this one is in February 2020. A Black girl pepper sprayed by police when she was in a mental health crisis at age 9. 2021, yeah, this happened just last week. Black high school student tased in high school because she was fighting. Again, just last week, right? Black high school student, another girl, slammed to the ground, handcuffed to prevent a fight at age 16. 2021, right? Those last 3 happened literally all in the last week. And so how does this tie with COVID? COVID-19 has exacerbated the inequities in our education system, and it's inflicted enormous trauma on students of color who are already historically marginalized. So now, thinking about law enforcement officials in schools, students also have to come back with the trauma of learning during a pandemic, which is, has been a global health crisis that's affected Black and Brown communities through death, job loss, lack of access to healthcare. And yet millions of students are attending or will return to schools that hire and pay for school police, but no counselors, some no nurses, no social workers. So when we talk about school reopening and safety, we have to mean safety holistically and not just safety from the coronavirus. For these students, this means, safety from racism, violence at the hands of school police, hiring counselors, other academic and social emotional supports that can help all students learn and thrive. So what are some of the challenges? Oh, sorry, Andrea, you can pop to the next slide. I just wanted to highlight these two events that happened just this past week. So what are some of the challenges we're facing right now? Getting state legislatures to reallocate funds to school resources for mental health and social emotional support, from backtracking from some of the bigger events and tragic school shootings in recent years. They were extreme measures taken in a for political measures, but not necessarily evidence-based and asking after what students need. Another challenge is, people getting spooked by the phrase defund the police. Now, the phrase itself has been highly politicized, and yes, that's what we're asking for. But when it comes to education, you have to understand the sentiment behind it. When you're asking for this in education, all we're asking for is students to feel safe and supported in their learning environments, and for them to be treated with respect and dignity, for them to be treated as our future citizens of our country. And if people get spooked by that concept, that is a bigger problem. And especially if it's your local leaders, those people should not be your local leaders. And politically, it's a popular option, but there's a lot of lack of education and misinformation around the issue of school police and other criminalization tactics. So research has shown that school police and other harsh security measures don't necessarily make students safer. Some of our state partners have actually said that local districts are under the impression that federal law mandates police to be in schools. I will tell you right now it doesn't, and I'll address some tips later on that. Students also report feeling safer when they feel supported by their educators, not criminalized. And plus, criminalization itself doesn't actually address the root causes of student behavior and underlying mental health needs that students have. Also, there's bipartisan misinformation. Our legislative analysis from the 2020 state legislative session showed that both Republicans and Democrats seem to struggle with how to legislate around SROs. And likely a lot of that was because of political pressure and misinformation on the issue. And lack of general awareness. So, the examples I provided earlier, those are just a few examples that happen to be recorded and that happen to make it to the news. The students of color are being criminalized every single day, and they're suffering long-term consequences for it. Plus, on top of that, there's no uniform system of collecting data on SROs. School resource officers is another name for school police. But many states do have state or local rules, laws, contracts between school districts and law enforcement agencies whose job it is to collect the data on SRO interactions with students. So now I'm going to flip to tips on how to overcome pushback on some of these challenges. The first is to be creative in how you ask for a different allocation of funds. Now, I'm going to bring up one example, which is the Legal Aid Justice Center in Virginia is one of our state partners. And this current legislative session, they are working on a budget amendment proposal. So instead of going and proposing specific legislation, they've gone the budget route, which is something that we haven't seen as often on this non-criminalization track. And what they're trying to do is get Virginia to reallocate $4.7 million that it usually uses for its SRO and school safety officer program and reallocate it into what they're calling their at-risk add-on program, which would allow for more flexible spending for student needs, especially with a focus on economically disadvantaged students and schools with higher populations of those students. And this would allow schools to use the funds for specialized instruction, dropout prevention, after school programs, and whatever students are needing to make up for what's going on, especially now. So that's one way that it's getting creative with how you're asking for these funds to be reallocated and reinvested. Another is to create local coalitions and let the youth lead them. When you think about the stakeholders in this realm, you have parents, you have students, you have educators who have so much at stake with this issue and so much pull with their communities. So creating coalitions around that can be such a powerful thing when you're asking for reinvesting in supports together in a unified voice. And letting the youth lead is important because their stories will move you, but also they know what they need. They're asking for what they need. They need to be heard. So that's important. Advocating for a uniform system of data collection and publication, and then holding your local leaders to it is also important. Now, getting your either understanding how data is being collected, what is being collected, if at all. Are students being arrested? How many? Are students interacting with officers? How many? Who? Disaggregated by sex, race, disability status, anything that could be helpful to understand what is going on in schools. And then you can use that data to hold your local leaders accountable. Without that data, you can't pinpoint what the problem is and how to move forward from it. And that will help inform advocacy and policy later. And lastly, teach community members and policymakers not to fall for the school policing myth. So one thing, I'm currently working on an advocacy fact sheet around how federal law doesn't mandate school police officers to be in schools. Locally, you can look into things like that and create fact sheets to disseminate in your communities. And then you want to engage your local policymakers on those issues, talk to them, teach them about why we want to counsel students instead of criminalizing them. And that can be an effective way of making sure that everyone feels heard and that misinformation isn't leading this issue. So with that, I will turn it over to our next speaker. Thank you.
Thank you so much, Sabrina. Off mute here. Yes,
Andrew,
thanks so
I
much.
have one question in the chat. I don't know if
sure.
you. Sure.
Go ahead.
Go ahead. So we have. Great. We have a question here that says, if these services are also important to students, why not make them available to all students equally instead of just the economically disadvantaged? I say this because the needs are there, the services are very helpful, and it's better to remove the disparities to get the entire community to support the efforts. Yes, I 100% agree with that. That example I gave you was one example and strategy that community felt they needed. But yes, I agree. These should be services available to all students, not just economically disadvantaged students. And of course, that's what we're asking for writ large. We're talking about economically disadvantaged students because of the racial disparities that we know are tied to the economic status. If Black students are receiving the support and care they need, if students who are economically disadvantaged are receiving the support and care they need, then every student is going to be as well. So, definitely we're saying to advocate for all students, but we also have to remember that the most impacted right now are receiving the least. So, but yeah, yes, 100% agree.
Thanks, Sabrina. And if folks have more questions, please keep putting them in the chat, and we have some time at the end to take some more questions. But turning to workplace rights, so similar as in the education space, when it comes to workplace rights, we're seeing a greater focus now on safety, worker safety in light of COVID, which is good. We've been working to broaden the narrative around what exactly workers need to be safe at work, what it means to be safe at work. And our COVID-19 recovery agenda talks about what states can do to require, for example, employers to provide specific safety protections for workers, like enacting state-level temporary emergency standards, which is something that Virginia, I think, was the first state to do. New Jersey, Michigan, and California have also done. And it also talks about the importance of paid family and medical leave and paid sick days, not just for this emergency moment, but we need those permanently for always. And Colorado and New York were two states that took action towards the beginning of the pandemic to do that. But workplace safety in this moment and always involves so much more than that. Longstanding gender and racial wage gaps have really left women with little to no financial cushion to weather this crisis. And without this savings, without a safety net or optimism about finding another job, workers are more desperate to keep a paycheck right now at any cost and less willing to report workplace abuses, which increases their vulnerability to harassment and retaliation at work. And we see with tipped workers in particular, those who are forced to rely on tips for most of their income, because in many states, it's near or the same as the federal minimum wage for tipped workers, $2.13 an hour. And now tips are even harder to come by because fewer folks are dining out at restaurants. So we see tipped workers being harassed by customers and asked to take off your mask so I know how much to tip you. And with little income or savings to fall back on, they're forced to put up with that harassment. So these harassment and discrimination issues are very much part and parcel of the safety and need to be parcel of the safety conversation. So, as we respond to COVID, part of that response needs to be raising the minimum wage. It needs to be raising the tipped minimum wage, having one fair wage. And that has been made clear and more urgent than ever. It also means strengthening our workplace anti-harassment laws. We saw a state senator in North Carolina a few months after the pandemic began, introducing a workplace anti-harassment bill to strengthen those protections as part of her COVID recovery package. This is what workers need right now to be safe. And it also means working on things like strengthening our equal pay laws to give employers the tools to efficiently, effectively, and equitably rebuild their workforce and give job seekers tools to secure pay that accurately values their worth. We're really concerned that for so many women, as I stated at the beginning, have lost their jobs or have been forced to quit to care for children or family members. As they seek to re-enter the workforce, they may be forced to accept a lower paying job because they don't have the savings to hold out for a higher paying one. And as a result, gender wage gaps will likely widen in the wake of COVID-19. So we really must do all we can to ensure that our hiring and pay setting practices are equitable and don't rely on things like an applicant's salary history to set pay, because that really forces you to carry those gaps from job to job. And I'm going to turn it over to Cassandra Welchland in Mississippi to really talk about what they've been doing around equal pay and a host of economic issues for women.
Thank you, Andrea, and everyone on this call for inviting me. It's very interesting to really hear what everyone has been saying around this economic crisis and how it's impacting particularly women and Black women. And the realities has been that Black women and their families was suffering even before the pandemic, and the pandemic has really exacerbated, the issue, has exacerbated the economic crisis and the wage gap. And so this moment in time is so critical and so key for really lifting these up. You pointed out so much already, that Black women and women of color are bearing, the brunt of the COVID crises. And in Mississippi, that is particularly true. In Mississippi, if there's any hope of recovering from COVID-19 pandemic and the economic crisis, we must name that truth, and we must center, Black women in our recovery and our relief efforts. And we don't want just a recovery, we want a just recovery. Black women in Mississippi, we are the drivers in our communities, and we contribute to this economy. 8 out of 10 Black mothers in Mississippi are breadwinners of their families. And we are on the front lines of this COVID crisis. We are the child care workers. We are the child care directors. We are the retail workers. We are some of the frontline workers in these hospitals. And so, and we're having to really choose, and we're losing our jobs, or our time, or our jobs are the hours are being cut related to this hard hit economic crisis. And so we really want these jobs to really recognize how essential, who's the face of these essential workers. And that is us, that is Black women in Mississippi. Of course, low paid jobs, not having the right kinds of protections, whether that's pregnancy accommodations, whether that's, like you said, paid leave, all of those things. And so we've been working at the intersections of race and gender and economic justice to really lift up these issues. And when we talk about the wage gap here, Mississippi has the widest wage gap in the country, and we're the only state in the country without an equal pay law in the state. And Black women are making 56 cents on the dollar paid to a white non-Hispanic man. And that's a pocketbook issue for women. That means our pocketbooks are half filled. Mississippi, as a state with the largest share of Black people, in the nation is 38 cents, but yet, we don't really have an equal pay law that can really address the race-based wage discrimination that we experience here. Had we had such a law on the books and there was equity here, we're talking about women when these economic crises happen, we could have had some money saved up to really care for, have some savings, right? To take care of ourselves and our families during such hard times. But there's a lot of inequity based on race and also based on sex. And, sex and race stereotypes and biases about women's competence, commitment and value continue to infect the workplace decisions and keep women from earning decent wages. And so what we've been doing, we have introduced legislation over the past probably 5 years and really bring attention to this issue. Who are we talking about? Mississippi, if you're saying that you care about your workforce, well, let me tell you who your workforce is. Your workforce, they're Black women who are not making what they need to make, but yet we are working. We're half the workforce in this state, right? Women are, and we're contributing to the economy. We're making $7.25, but you say you value us. Well, you haven't put in the right kinds of policies and practices so that we can take care of ourselves and our families. If today's wage does not close, a Black woman in Mississippi stands to lose $849,480 over the course of a 40-year career. And that means that the typical Black woman starting at age 20 would have to work until she's 91 years old to catch up to her white non-Hispanic man's earnings at age 60 when he retires. That's pretty stark. So we launched this campaign called the Pocketbook. And what we're meaning by that is that equal pay is a pocketbook campaign. A pocketbook issue, the power of the pocketbook. Women do so much more with less with that pocketbook. We take care of our families, we feed our families, we pay the utility bills, but yet we are not getting the wages that we need. And so we launched the power of the pocketbook. We're saying invest in women, invest in Mississippi. When you invest in us, you invest in Mississippi. And so we have introduced the legislation. We launched this campaign so that we can hear from women, because it's so important for us to humanize the stories. What do these pocketbooks mean for your household and for your community? So we want to hear from women. And so we're launching the storytelling project to hear from women about what does the pocketbook mean for your household? And we're talking about even, historically, your grannies, your Medeas, your aunties, your moms. Tell us those stories, because we really want to even more make the case that equal pay in Mississippi is important and to Mississippi's economy. And then we also have an Equal Pay Committed Cities campaign where we're asking mayors to be a part of this. We want cities to take the lead. While we haven't been able to get it at the state level, we're going more local and asking these mayors to join these efforts because the local economy is what supports the state economy. And then the other thing, we're going to be doing more training and education and partnering with some of our partners to do some trainings around wage discrimination so that workers can recognize when they are being discriminated against and have some relief on what to do. So these are the things that we're doing. They're all pocketbook issues. Equal pay is a pocketbook issue. Childcare is a pocketbook issue. Paid leave, sick leave is a pocketbook issue. And women's pocketbooks matter, and matter to our families, they matter to our communities, and they matter to our state.
Thank you so much, Cassandra, for the work you're leading in Mississippi. I'm going to turn it over to my colleague, Mara Gandal-Powers.
Hi, everyone. Can you hear me okay? Okay, super. Thanks, Andrea. You can even go to the next slide. So as Andrea said, I'm with the National Women's Law Center's Reproductive Rights and Health team. I'm our Director of Birth Control Access, but I'm here representing the whole team today. And I really want to thank you all for sticking with us through the webinar and for your interest in all of our issues. And especially as we're thinking about the COVID crisis, I mean, obviously the COVID crisis is a health crisis because it's a virus, right? It's a virus that can make people very sick and has overwhelmed our health systems. But as you've heard from all of our presenters today, it is much more than that, and it's touching just about every aspect of people's lives. And so when we're thinking about how to fix the health crisis, we're certainly thinking about the health solutions, getting people to wear masks, social distancing, distributing vaccines. But we are also thinking bigger than that, right? And longer term than that, because the disparities that we are seeing today in the impact that the coronavirus has caused with Black and Brown communities, in particular, suffering the worst from the virus and its repercussions, those disparities are happening because of the systems that were in place before the virus even got here, right? And so it's not because of individual or community failings that the virus has impacted Black and Brown communities the most. It's the disparities are driven by systemic barriers to healthcare. And we as communities, cities, and states have not adequately addressed those. And we need to create systems that meet people where they are and address those barriers to care. So that means, in large part, addressing barriers to comprehensive health coverage and quality care. So when we think about comprehensive, accessible health coverage, we're thinking about coverage of all services, including reproductive health services. And I will get to that in a moment. But one of the reasons that we're particularly thinking about access to comprehensive health coverage right now is how to help people be healthier and address the underlying conditions that make COVID-19 more deadly. And one of the other things health coverage can do is help prevent folks from going into medical debt. We know that the ACA certainly helped alleviate some of the problems around medical debt that we had been seeing, but the average cost for someone who's hospitalized with COVID-19 is between $34,000 and $45,000. And that's just the average, right? We know that there are many people who are hospitalized for a long period of time. And even if you survive the virus, that debt is going to bury you. It is awful. And it's going to impact your whole family, not just you personally. So health coverage is really important. So as we're thinking about this, what can your state do in terms of health coverage? So your state can expand access to Medicaid. One way to do that is expanding coverage for low-income adults, as they did the ACA provides for. You could be working towards that goal. That's one place to work. Many states have already done that, which is fantastic. But there are other ways you can also expand Medicaid eligibility through changes in income limits for existing categories of coverage or adding new categories of people who can be covered by Medicaid. And your state can also increase enrollment on the ACA exchanges, right? These are the marketplaces for health insurance coverage that were created through the Affordable Care Act. If your state has folks who enroll through the federal marketplace, you as an advocate or your state can encourage people to enroll during the upcoming special enrollment period that's going to be happening. During the prior administration, the open enrollment period was really crunched to a shorter time frame, which makes it more difficult for people to enroll. Particularly, as it's during the holidays, nobody's thinking about their health insurance when they're thinking about Thanksgiving dinner or Christmas and what they want to put under the tree for their kids. Gets to be January 1 and they're starting to think about, do I have health insurance? And so now we do have an extra open enrollment period this year for the federal exchange, which is really important. For some states that have a state-based exchange, the state could open its own concurrent special enrollment period as the federal open enrollment, and that's another way to get more folks covered, which is incredibly important. And as I said, sort of at the start of this, comprehensive health coverage really must be available to everyone who needs it, and it has to include the full scope of care people need, and that includes reproductive health care. Here at NWLC, we regularly partner with state advocates that work on abortion and birth control access. And as we're thinking about COVID response and recovery, that's a really crucial part of the picture. Protecting access and expanding access to reproductive health care, it's essential for people's autonomy and well-being. And it's especially so as we're in the middle of this crisis that threatens folks' health, livelihood, and financial security. The pandemic and the recession have created new barriers to accessing this care, and they've worsened existing ones. And for many people, especially those who are already more likely to experience barriers to access, this means they may not be able to access the reproductive health care they need when they need it or at all. So, from our perspective, ensuring that reproductive care is accessible and affordable has to be a core component of the response to COVID-19 and the economic crisis. So when we're thinking about policies that states can adopt, there's a number of them, and I'll run through them, and certainly I'm happy to talk more about them during the Q&A. But one of the things that we saw early on in the crisis was that people were having difficulty accessing abortion care because it was not considered essential when social distancing or stay-at-home guidelines were put into effect. And making sure that contraception and abortion are considered essential care during a public health crisis is very important, because they are timely, and when you need access to that care, you need it when you need it. So that's one important thing that folks can do. Another is protecting reproductive health care providers and encouraging the use of telemedicine when it's possible. I think there's been a lot of advancements in telemedicine very quickly in the last 11 months that have been necessitated. And there's a lot of reproductive health care that can happen through telemedicine. You don't always have to be in the same physical space as your healthcare provider for a lot of this care. Another important area is places where we can either suspend harmful or unnecessary restrictions on birth control access or eliminate them entirely. And so some of those things which we see in a number of states are mandatory delays on accessing abortion care. That often forces patients to make multiple trips to a clinic, right? So you have to go one day for your counseling, and 48 hours or 72 hours later, you can go in for your abortion. And, obviously that is a burden to have to make multiple trips, but particularly right now in the middle of a pandemic, you are then exposing yourself more times potentially to the virus. Another area is insurance coverage bans. It makes it even more difficult for pregnant people to pay for the care they need during a global health crisis. So if you don't have insurance coverage of abortion, it can be really difficult to access the care that you need. There are also, outright bans on abortion in many states, and laws that are designed to shut down clinics, which force people, to have to travel out of state, which is something that many folks are not doing these days at all. But if you can imagine, you have to do that to access the care you need and expose yourself to COVID. It's a real risk. And there's also a number of other areas that are really important for accessing birth control in particular. Family planning services are underfunded, I would say, both at the federal and state level broadly. So adequately funding family planning services is something that is incredibly important. And we know from surveys at the beginning of the COVID crisis that many people were trying to prevent or delay pregnancy during this time. And we've started to see some numbers coming out saying that what people were thinking there was going to be a baby boom. Everyone was holed up at home. What else were they going to do except, make babies? And there actually wasn't, right? There was a big baby bust. And what we haven't seen yet, and these are the numbers that I'm really waiting to see, is where was this baby bust really happening? Because every other impact of COVID, there's been a disparity. And so are we seeing folks who can access birth control and abortion still not having children, and other folks who can't having children, when we know that people across the board wanted to prevent pregnancy right now? And I think that's the data that we're still waiting on. Obviously, we are 11 months in, so the folks that were not able to access reproductive health care at the beginning of the pandemic will just now be having children. And so I think there's still data to be seen, but in my mind, there's no reason to think that this one data point would not be impacted differently than others. And another important piece of this, right, is ensuring that healthcare providers' personal beliefs don't prevent people from accessing the care that they need. And that's something that's, really important and central in our work regularly. But right now, with limited providers that are open or seeing people, the last thing you want is to get to a provider's office and not be able to get the care you need because of their personal beliefs. And I think that's a really important thing to keep in mind. So I know that we have a wide range of advocates on the call today, and your work right now might not be health. And even if you are doing health work, it might not include reproductive health. So you may be thinking to yourself, why would I take this on now? Why take on something that seems so controversial when there's already so much happening? And I think you need to know that the truth is these really aren't controversial policies, right? The ACA and Medicaid have broad support. Recent polling shows that, and we're happy to share some more of that polling. I don't need to go into all the numbers for you, but 62% of adults wanted the incoming administration and Congress to either build on what the ACA does or keep it as it is. And that's a good support for it. And the pandemic has not changed the majority opinion that politicians should not be restricting reproductive freedom, right? 2/3 of voters agree that politicians should avoid doing anything to restrict people's access to reproductive care during the pandemic. And that includes 79% of Democrats, 62% of independents, and 51% of Republicans, right? So I think the narrative is often that this is really controversial, but it's not. It really isn't. And among people who support legal abortion and even people who feel conflicted, a full 78% agree that abortion is time-sensitive, essential medical care that women should be able to access in this moment, right? So it is a huge majority. Aside from the popularity, I think the ability to care for yourself and your loved ones, to have control over your own body, is so fundamental to people's self-determination and well-being. And right now there's so much going on in the world that we can't control. And I think people are really seeking to have that ability to know where things are going, at least for them in their own self, right, in their own body. So I guess I'll end by saying, it's highly likely that there's a group of advocates in your state working on health issues, and that are advocates in your state working on reproductive health rights and justice issues. There may be even a gender justice table in your state, and I would really urge you to join those tables if you aren't already there. I think we've all lived through just almost a year now that has demonstrated for us how interconnected the issues we work on really are. So I'd urge you to start making those connections, or keep making the connections if you already are, between childcare and education and workers' rights and tax policy and healthcare. And if you don't know where those conversations are happening in your state and you'd like to be part of them, please reach out to us. We can help connect you. We can support you in that work. And I'm looking forward to the Q&A session. But before that, I'll turn it over to John, who's from CBPP, who's going to talk about how state fiscal concerns interplay with everything that we have already talked about today.
Thank you. Am I good to go? Yeah. All right. So I'm going to take you on a little virtual field trip here to your local state house. We don't have the money. Now's not the time. We've got to live within our means. The economy, it's just too fragile right now. Well, we've got to trim the fat and cut waste first. So As a state level advocate for gender, racial, and economic justice, you've probably heard these phrases or some variation of them dozens, if not hundreds of times. That's why I'm really excited to be part of this webinar and appreciate the invitation, because the work that my colleagues and I do at the Center on Budget, which focuses on how states raise and spend their dollars, is really an important glue that can hold all of our various policy priorities together. We think it's critically important that issue advocates of all stripes in the progressive ecosystem engage in state budget fights, and that we all do it together to help build the kinds of communities that we want to see in our states. So what's going on in state budget land these days, and what can we do about it? I'm going to give a quick update on the current context that we're seeing in the states before pivoting in a few minutes to some messaging and framing strategies that you can use when talking about state fiscal and economic issues. So first, the context. Right now, states as a whole are still facing revenue shortfalls and tight budgets. I forget the number that was mentioned about Illinois, but there are shortfalls in states, and some are still quite large. But nationwide, across all the states, the picture is not nearly as dire as we thought it might be when we first started running projections, 10 months or so ago. This is due to what's been referenced several times on this webinar, the uneven nature of the COVID pandemic and recession. It's a recession where it's disproportionately Black and brown people who are struggling, while wealthier white people are employed, kind of doing just as good as they were on the whole, but as before the recession, if not better. So this has actually kept state revenues more on track than we expected. On top of that, of course, we've seen a sizable amount of federal aid to states and also stimulus to individuals that's helped keep revenues more stable. And of course, more aid and more stimulus may be on the way, which will continue to help to prop up state revenues. So in some ways, in a lot of states, this can make our jobs easier because we don't have to fend off as many, devastating budget cuts to vital programs. But on the other hand, and kind of what we're seeing in a lot of state capitals right now, is that this lack of crisis is also, I should put that in kind of in air quotes because it's a lack of one type of crisis. I think we all know that there are many other crises actually going on, but this lack of a revenue crisis is making it much harder for our work to raise new revenue from the wealthy or from profitable corporations. And in fact, in some states, we're seeing the right-wing tax-cutting agenda back in full force. A few states, including Mississippi, West Virginia, and Arkansas, are currently considering the complete elimination of the state income tax, which would decimate revenues and make the tax code even more tilted to top earners than it is now. Many more states are considering other significant tax cuts this legislative session. Now, on the other end of the spectrum, a smaller number of states are considering significant new revenue proposals, both to cover budget shortfalls and, in some cases, to fund important new initiatives. I want to quickly lift up Minnesota because I think the governor's proposal there is framed really well for kind of what we're hoping to see more of. It raises a ton of new revenue, largely from wealthy Minnesotans and from corporations, in large part to cover the state's projected budget shortfall. But importantly, the numbers don't match up. The new proposed revenue is much more than the shortfall. And the extra dollars would be going to a wide range of important priorities for our communities, right? Expanded tax credits for low-income families, education, and more. So, this is a proposal that offers us more than a return to some sort of pre-COVID baseline, right? Some status quo where too many families and communities were left behind, facing years and decades of disinvestment and really struggling. It's a step, a small step, but an important step toward building a stronger revenue system that can help all of us achieve a more just society. And to us at the Center on Budget, this is the kind of stuff that we're pushing our state advocates to put front and center as they talk about a COVID recovery agenda. We want to do more than just get back to a status quo that did not work for so many people in our states. We can go to the next slide. Thank you. So like anything else, how we wage these battles is crucially important. I'm going to go over, some really sort of higher level messaging and framing suggestions. We have a lot more of this, particularly around tax and fiscal issues, and resources that I can share. If you're more interested, we'll have emails at the end. You can reach out, all that kind of stuff. So much of the opposition to our agenda is rooted in a frame that pits the interests of working people or working families against the interest of the economy, right? But these interests are not diametrically opposed. And we find that we do best when we can flip things around and make the case that the economy isn't some stagnant, immutable force that happens to us. It's not the weather, it's a system that's fueled by working people. So in this kind of frame, what's good for working people and communities is good for the economy. This is where you really want to lead with shared values, like economic opportunity or thriving communities or safe and secure families, whatever the case may be in your instance, but tap into some widely shared value. And when we lead with those values and then connect them to our specific policy ideas or solutions, we're much more likely to persuade the people who can be persuaded. Of course, there's people that we're never going to persuade. And by and large, our suggestion on messaging and framing is just to leave those people alone. Another important thing that we suggest is to not shy away from disparities. We know, and to really lean into them, right? We know that economic outcomes are uneven across gender, race, and geographic lines. This is far from the kind of world that we want to live in, obviously. So we can and we should cue up the disparities and name them head on. One piece of caution, I think, when we do that, it's important to also really take care and to not sort of strip agency away from communities that we're discussing. As a really quick example, saying a phrase like people experiencing hardship or people experiencing poverty is a much stronger frame than saying impoverished households or just saying like X number of women are below the poverty line. So in other words, I think what we're suggesting there is like what you're trying to do is describe what people are experiencing, but not label and define them solely by that experience. That's really kind of a big part for us about sort of like a people-centered economic frame. Of course, for me and my colleagues, and for those of you who engage in state budget fights, then comes an even tougher task, which is connecting all of this to what can be really a third rail in state capitals, taxes, and government. Even, and sometimes especially among communities of color and low-income communities, taxes and government are a tough sell, and frankly, rightly so. Especially in some communities of color, there's really strong distrust of government. In immigrant communities, there's a strong distrust of government, and I think that's well deserved. But it's really hard for us to win the kind of revenue that we need to create the just society that we want without addressing this head on also. So a few tips specifically about kind of talking about revenue and taxes. You want to connect the dots between the programs that help create thriving communities and how they're funded through taxes, right? Kind of like really walk through like this healthcare program is funded by the income taxes to our state, that kind of thing. Second, you want to ground any critiques of the current tax or budget policies. If you've got a sort of upside down tax code like so many states do, where lower income people pay a higher percentage of their income to taxes. You want to ground those kind of critiques in a vision of what could be, right? You want to be aspirational, not just say what we don't like. And I liked that example from Illinois before about kind of trying to uplift some positive things on social media. It's always good when we can be aspirational and to remind people what does work about government. Third, you want to acknowledge that people might feel like they have no influence on government, right? That's a very common perception. And then really quickly pivot to what they can do and to who they can contact in order to have an impact, what kind of letter they can sign, give them a way to take action and feel like, hey, actually, I am having some sort of influence. And lastly, I think it's really important to highlight stories of successful collective action that are led by average people and community organizations, either working with or through government. And those kind of stories can really inspire and empower people. Things like when a local community gets together to like block a highway expansion that's going to divide their neighborhood. Little things like that are really great examples to lift up to show that, yeah, we can change things for the better. And if we work together, we can have an impact at the State House too. A few other important things to keep in mind. Just like we should center people in our framing of tax and economic issues, we also need to center solutions. So this includes both like what the revenue solution is going to be, what kind of taxes, et cetera, and really importantly, the kinds of solutions that to our social problems that those revenues could fund. Maybe it's full-day preschool in your state, maybe it's expanded healthcare, maybe it's larger childcare subsidies, but talk about what could happen with the revenue, talk about your vision for the state if we were able to raise the kind of revenue that we want. And the last thing I'll touch on is to keep things as much as possible, which is hard in state fiscal space, simple and human, right? You want to add stories that help make abstract policy debates more real. You can use social math to help show the scale of big numbers and show their real impact on families. So I'm going to leave up these two visual examples. Oh, thank you, Ari. Shifted the slide. Appreciate that. That I really like from our state network as I flag a couple quick things to wrap up. First, the emails will be up at the end. Please contact me anytime if you have questions about state fiscal issues or messaging. Also, if you aren't already working with the State Priorities Partnership Organization in your state on revenue, or kind of if you're not at a revenue table, you definitely should be. You can find those at statepriorities.org. And then lastly, I'm currently helping to run a learning community for state advocates who are interested in beating back some of the austerity messages and frameworks that we're seeing all over the country. We had a great initial meeting in January, and we're having a second one later in February. So if you're interested, again, you could email me, and I can also drop a link to sign up in the chat in a moment. So that's it for me, and I will turn it back over to our hosts. Thank you.
Thank you so much, John, for concrete strategies. And thank you to all of our speakers for the massive wealth of information and ideas and strategies you shared. The good news is that a lot of them are in the playbook, the State Playbook for Gender Justice, and we'll circulate that afterwards so you have that. So you don't have to have memorized everything today. And all of us and that have spoken today seem very eager to help you out moving forward. So we'll open it to questions. And again, please drop them into the Q&A box. I'm new to figuring this out, but I'll lift up a few questions that have come in thus far. Somebody noted that Hawaii introduced a feminist response to COVID. I think that came out over the summer. And I do not know what has passed from it or not, but I know that New York, a coalition of groups in New York, also came together to do a similar gender justice focused response to COVID. The question was, have other states done that? So another example to look to as well. And I think, yeah, issues are meeting very varying success in states. We've been working with some partners on an equal pay bill in Virginia, which this was the first year that it moved farther than before. It got to a working group. And, you know, a lot of the narrative around that bill was framing this about COVID and our concerns about the wage gap growing due to COVID, and we need to take action now. So I think that was helpful. I don't know if Mara, you want to speak to the legislative strategy question about anti-abortion bills?
Yeah, it's a really good question. And I think, like many things, you know, it depends on what state you're in. It depends on what the bill is. And we'd be happy to follow up and chat some more about what you're specifically dealing with. I mean, I think from our perspective, anytime we can to stop one of these bills is really good. And I think there are some times where we know that they have votes for the bills and we are trying to make them less bad, right? So unfortunately, sometimes that means even getting exceptions in for rape, incest, or when the pregnant person's health is endangered. I mean, that is a strategy to make the bill better sometimes, because those bills are going to move. So I think it depends on what you're talking about. There is a lot of work that happens around the communications and how to talk about some of the really tough issues in the abortion bills that are coming up. And I think those are the kinds of resources we'd be more than happy to share. But they are specific and different depending upon the kinds of bills. So, you know, if you're dealing with a method ban, or you're dealing with the reason ban, or you're dealing with, you know, a waiting period, it can differ. So happy to talk more, and would love to connect you with folks on our team for that.
Thank you, Mara. I see in the chat here that somebody, Audrey Hall, lifted up that the Massachusetts Commission on the Status of Women has conducted 2 studies on COVID's impact on women, and one on childcare and education. And we'll have a hearing coming up soon in February 24th. So if others have examples of states that have been actively thinking of COVID in this gender justice frame, please drop it into, I guess we have a chat as well, the chat or the Q&A. It's always so helpful to hear of other examples. And one other comment that came in was from Casey Wagner, I think had to drop off, but she wanted to uplift the fact that the National Domestic Workers Alliance, NDWA, has a care platform. And if anybody from NDWA is on, please, I don't know, raise your hand, let it be known, because it would be great for you to speak to that more, but really focus on making sure that domestic workers who are predominantly Black, Indigenous, women of color, immigrants, and undocumented have been historically excluded from workplace protections. And so trying to get domestic workers included in a whole host of workplace anti-discrimination, anti-harassment protections. And that is incredibly important. And domestic workers are very much on the front line of this crisis and being impacted by it. So I think this is an important moment to, again, frame who's being hurt by this pandemic, who we need to center in the recovery, and get rid of some of these historic racist exclusions from our laws. Okay, are there any other questions? I know that Hannah Beth Jackson from California uplifted all the great work that California has been doing on paid leave and equal pay. I will mention that I think this fall, so very much, you know, in the midst of this pandemic, California passed legislation to require employers to report their pay data broken down by race and sex, so that report that to the government in California, so that we could have a better understanding of what wage gaps look like, what industries are most problematic. And I'll say we at the Law Center think this is an absolutely crucial type of public policy reform. We're hoping to see it at the federal level as well, but states can take the lead in advancing that. And I think the advocates in California talked a lot about this in terms of COVID and who's being impacted, and we can't fix what we can't measure. And so we need that data. Okay. I think those are all the questions. If any of the other panelists have a question I missed, or a last thing that example you want to lift up?
There was just there was one question in the Q&A, folks didn't see it, about which states have federal and state, and I dropped a link in there for Marketplace. So if you aren't familiar with the Marketplace website, it's a helpful place to get to.
Great. Thank you all so very much for attending and receiving this information, sharing your own information, and it was really great to be with you today. And thank you very much to our speakers. We will follow up by email with resources. Thanks, everybody.